One, over to you.
Good afternoon, everybody, and welcome to the County Executive's weekly press briefing. Today, we're joined as usual by County Executive Marc Elrich, Health Officer Travis Gayles, and Director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. We have a special guest today who is joining us, Councilmember Will Jawanda. We've got a full list of things that we want to talk to you about today. So without further ado, I'm going to hand it over to County Executive Elrich to go ahead and get us started.
All right, so I want to thank everybody for joining us again today for our weekly briefing, and I want to thank Councilmember Jawanda for joining us. I will be returning at the end of the COVID part of this briefing to introduce him and talk about an important piece of legislation that I will be supporting that he'll be introducing. To start with COVID and the vax rates in the county, today we find our positivity at 0.87% and a case rate of 1.52 per 100,000. And we had 15 new cases in the last report. Over the last several weeks, you've heard that we're returning to normalcy, but we are not declaring mission accomplished. It's pretty clear that the mission is not accomplished. The more contagious Delta variant is beginning to make up more than 50% of the cases nationwide. And while cases are rising in 26 states, that also includes Maryland. So most of the counties have bounced off of their low points, including Montgomery County. We're not anywhere near where we were before, but we are also not at our low peak. And so we're aware of this. The Delta variant is flat out more contagious. It is easier for people to contact it, and they are more likely to get sick. And I think it is well acknowledged by everybody that this variant is going to be problematic. The good news in Montgomery County with having so many people vaccinated is that our hospitalization rates remain low, and there aren't a lot of places for the virus to go. Currently, 69% of our residents have received both doses of either Pfizer or Moderna or a single dose of J&J. 76% of all our residents have received at least one dose. And we continue to lead the nation for our 12 and old population vaccination rate for jurisdictions over 300,000 at 81% of our population over 12 is fully vaccinated, and 90% have had at least one dose. People need not to let down their guard, because one of the things about Delta is if you've only had one dose, you may remain vulnerable to Delta. It is that infectious and that much more transmissive. So if you've got one dose, do not think you can relax. Go get your second dose, unless it's the J&J, in which case it is only one dose. And we are continuing to double down on vaccinating our population, because it's critical to take away the opportunities for the virus to reproduce itself. And that is what this vaccination push is about. It's not simply protecting you, but it's the sooner we squash the virus and the fewer cases there are, the less likelihood that the virus will mutate. So the more cases there are, the more reproduction events there are, the more opportunities there are for mutations. So this is about protecting all of us. As much of the work we've done over the last year has been the decisions we make just don't take care of you and me personally, but they also help make everybody else safer. And getting vaccinated is really, really going to be and continues to be important. Our 12 and older population is the only group eligible to know that made no. Let me reread this. That 12 and plus population is, we think will be at 90%. The fact that we'll be at 90% in a few weeks is really encouraging. And beyond their overall stats, I'm very proud of the efforts we've made on vaccine equity and outreach throughout the county. We continue to make sure that our vaccines are being taken up by everybody in the county. And when you reach over 90% in the 65 and older category vaccinated, that means that everybody's gotten vaccinated. Republican, red, blue, everybody is getting vaccinated when you start achieving numbers like 90%. So I'm really glad that people are taking the advice and going there. Behind CVS and Walgreens, Montgomery County Health Department is third in the state with distributing vaccines. And that's no small accomplishment. Nationally, as Montgomery County succeeds, it's frustrating, for me to witness the continued politicalization of the pandemic across this nation. Over the weekend, there were multiple news reports of conservatives celebrating and cheering over low vaccination rates. I don't know how insane, what's the right word to describe how insane that is, but low vaccination rates are going to mean higher hospital occupancy rates and more deaths and more sickness. It's disturbing and very selfish of people to think that not being vaccinated is a good thing. And we are fortunate that that is not the way the bulk of the residents feel in this county. But what they're doing out there ultimately could put everybody else in danger. So I'm hoping that at some point common sense prevails and people decide that they're going to get vaccinated. There are millions of people around the world who still don't have access to any vaccines. And we have people who are celebrating not getting vaccinated. It is a sad state of affairs. This virus is going to continue, it's going to stay around, and it's going to be a threat as long as this kind of stupid behavior continues. So we can only hope that it comes to an end and people realize that this is in their best interest to make sure they don't get sick. Another county COVID updates is, many of our departments returned to focusing on pre-pandemic issues. We continue to address several areas of recovery. Our rental relief programs have currently distributed over $25 million to 5,000 households. We want to remind all Montgomery County nonprofits that next Monday, July 19th at 5 p.m. is the deadline for applying for EDC grants ranging between $10,000 and $20,000 for Montgomery County nonprofits. So if you're in a nonprofit and you haven't applied and you have a need, please get those applications in. One of the good news is about the housing rental relief is that we now have everybody who has evictions is in the pipeline to get relief. So if you've got an eviction and it's COVID related, the evictions that we've seen so far, those folks are in the pipeline. We continue to work with the judges and the courts to try to get updated lists on a regular basis of what evictions will be pending so the county can contact those tenants and contact the property owners and assure them that we can help work out financial payments so that people don't have to be evicted. The grants for nonprofits will go to current and proposed programs that are in support of 4 identified priorities: minority and women ownership, entrepreneurship, STEM education, research and innovation development, and small-scale manufacturing. So that's the focus of these grants. Finally, I want to thank all the folks at ABS and Montgomery County Department of Transportation for their partnership and collaboration in the successful streeteries, the outdoor dining locations. What started as a quick and practical solution to help our restaurants stay in business during the pandemic has quickly become a popular option for diners. And it's my hope and intention that the streeteries can stay as long as they're desired by the restaurants and their patrons. I've been to a couple of restaurants and I note that the inside is not nearly as crowded as they used to be. Lots of times I've seen more people sitting in outdoor spaces than I've seen sitting in indoor spaces, despite the heat. So I know people are still exercising caution, and exercising caution is a good thing. So we're going to make sure that everything we can do to support the streeteries, we will do, and make sure they can continue in operation. And with that, I'll turn it over to Dr. Gayles and Dr. Stoddard for their updates.
Good afternoon, everyone, and happy Wednesday. In the interest of time, I don't have a ton of updates beyond the county executive. We continue to exhaust our efforts in terms of getting folks access to the vaccine. We are hopeful that those who are unvaccinated please consider coming in and getting vaccinated. We do have ample supplies in all the different venues, and you getting vaccinated will help protect you, protect your family, and continue to drive community transmission down in the face of the different variants. We do continue to get reports of variant cases happening in the county that have been sequenced by the state. We do anticipate that in the very near future, if not already, the Delta variant will be the predominant strain in the state of Maryland. And we also have had some reports, some sporadic reports of a Lambda variant, which originated in Peru. Beyond that, we continue to work with our colleagues across different industries and school systems as well to help provide guidance as they continue to move back in terms of returning to school in the fall. And we continue the other work in terms of public health, including our ending the HIV epidemic work and our work in population health, particularly in diabetes prevention and management. Happy to answer any questions you all may have, and thank you for the opportunity to be here.
Good afternoon. Much like Dr. Gayles, I don't have many more comments to add to what the county executive has already provided. We continue to focus, as he noted, on our recovery efforts to include issues around equity and health equity, particularly, as well as economic revitalization, trying to understand using data the impacts of the COVID-19 pandemic on various business sectors and what we can do in terms of job training and opportunities for our workforce to have them be more prepared and targeted towards addressing the gaps in employment that exists within various industries right now. And so we're trying to really collect data, understand exactly where the economy is moving, and be able to align our workforce through training with those new opportunities. And so obviously the recovery framework has been in place for over a year. We talked to the county council yesterday about the updates that we are providing to that framework to allow us to move from what was short-term recovery to intermediate recovery and beyond. And we expect that we're going to be doing many of these activities for months, if not years to come. So that's all I have for today. Thank you.
Okay, I'm going to hand it back to the county executive so he can introduce the council member and the thing that he's here to talk about.
So I want to thank Councilmember Jawanda for joining us again today. He's the lead sponsor of an expedited bill 3021, which is going to extend the limitation on rent increases from 90 days to 1 year after the expiration of the public health emergency. And the bill would also prohibit charging late fees accrued during and for 1 year after the emergency. This is much needed legislation. It's smart legislation. It's compassionate legislation, and it recognizes the reality of what's happening in the community. You know, we talk about our COVID numbers, and it's great that our COVID numbers are going down and that we've managed to manage the health part of this crisis, I think, reasonably well. But despite our ability to be able to manage the health crisis, the damage done by COVID to the economy is real, severe, and it's long lasting. You can, even in Montgomery County, you can go by rows of shops now that are still closed. People are still out of work, not because, as the governor suggested, everybody's out of work because they don't want to work and they're enjoying these, kind of meager unemployment benefits. They're out of work because they're on jobs. I've gone to restaurants, and restaurants that used to open at 8 o'clock or 9 o'clock in the morning are opening later. Restaurants that used to have many people on the wait staff only have a couple people on the wait staff. There are businesses that have curtailed their operations, reduced hours, and then there are the people who aren't opening at all, the businesses that have been lost. And the other casualties beside the businesses are the employees who used to work there. And I want to thank Dr. Stoddard for talking about the job training, because we may have job openings, but it does not mean that the person who was a waiter or waitress yesterday or working in a retail department of Home Depot yesterday has the skills and training to take some of the jobs that are becoming available. So the work of retraining a workforce to work in what may be a different economy and a different labor environment is not something you can turn on a dime. If people had had those skills, they would have taken the better, higher paying jobs in the beginning. So the need to upscale our workforce or upskill our workforce is really important, and it's going to take time to do that. This economic recovery is going to take longer than the health recovery. And we need to continue to support people who aren't able to pay rents. And I think, 1 year extension is reasonable. The headlines we're reading in the newspapers are that as COVID recedes, that landlords are asking for large rent increases across the country. And there's no reason to expect that landlords in Montgomery County will abide by the guidelines we have for rent increases. They didn't abide by the guidelines necessarily before COVID, and there's no reason to believe that they would abide by them after COVID. So I am happy to support the legislation that Councilmember Jawando is going to introduce, and I'll let him talk more about it now. Thank you.
Thank you, County Executive Elrich, and really appreciate the opportunity to join today and appreciate your support of this bill. It actually is introduced. I introduced it yesterday in our council session. It's, as you mentioned, Bill 3021. And it would do two really important things, just to underscore these points. First, it would extend the time period. Last April, I introduced a bill that the council passed to halt increases past the voluntary rent guidelines up until 90 days after the state of emergency declared by the governor. We now know that the governor has said that he's ending the state of emergency. He just renewed it for 1 more month, so that now is around August 12th. But we know it's ending very soon, within a matter of weeks, which would start that time clock for when rents can go up. So this bill would extend that time period for a year after the state of emergency. So if it ended on August 12th, for example, it would be August 12th of 2022 before a notice of a rent increase could be sent. The second thing that this bill would do, very importantly, is prohibit the adding and accrual of late fees. So if late fees have already accrued, they would still be valid or been paid. You don't have to pay those back, but it would limit the ability to add on late fees through the state of emergency a year after. We know that so many people are still struggling. When we opened the rent relief, and we're tackling this from both sides. County Executive mentioned all the work and money that the council appropriated and he has put forward that we've done together to get to renters. We had 7,000 applications in the first week when we opened those application portals. We're continuing to get that money out. That's a key, and that goes right to the landlords. So we're supporting on that side. But we also need to make sure that we're protecting against rent gouging and dramatic increases and the accrual of late fees. We know if you look at this period in time versus the Great Recession in the early 2000s, in the mid 2000s, give you one stat that's just staggering. Payroll employment in the United States in this year, was down 5% from February of 2020 of last year. Compare that to the lowest point of the Great Recession was 5.3%, the lowest point when we were losing all those jobs. So we're at a comparable rate of payroll employment being down, right? Despite that, and just kind of underscores the point that this is an unequal recovery. We are making progress. Certainly have made a ton of progress on the health side, but the economic effects of this are going to be felt for years to come. There's still much documented about the Great Recession, how long it took, and it's still taking for families to come out of that and fully to recover equitably. So this is a really important bill. Unfortunately, the governor ended the state of emergency, and the action he took to stop or try to stop the unemployment enhanced benefits. Thankfully, the courts yesterday denied that and blocked that effort, so that will be in place. But we know people want to work, people want to pay their rent. It's just the fact that this has hit communities, particularly communities of color, particularly women, the hardest. And so there are thousands of residents who are going to need this type of support. And the last thing we want to do is to put their housing in question or force people to move while they're looking for a job, while they're dealing with all the issues that we've seen with COVID. So really excited and appreciate the county executive's support of this and look forward to working with my colleagues to get it passed. There'll be a public hearing on the bill on September 14th at 1:30 p.m. For those that are interested. Thank you, County Executive.
Thank you.
Thank you very much, Councilmember Jawando. We're now going to open the floor up for questions. Reporters, make sure that if you have a question, to please place it in the chat. We also have several other people who are here on the call, just in case there are questions that you have that they may be able to assist answering. Our first question for today comes from Kate Ryan from WTOP. Go ahead, Kate.
Hey, thank you very much. While we just wrapped up the discussion on the rent issue, Mr. Jawando, quick question for you. Did you confer with any apartment owners, particularly small building owners? Have you gotten feedback on this? Because I think everyone can recognize that, you know, folks at certain levels are getting hit much harder than others. I would imagine that those guys, landlords, have bills they have to cover, they have to pay. What kind of feedback are you getting?
Sure. I appreciate the question. Look, it's important to remember, I think it's a common misconception, you can still increase the rent if this bill were to pass and under the current law. It's just what are the normal voluntary guidelines. I think last year it was 2.6%, it's 1.4. This year it's going to, it's based on the CPI, and those come out every year, and the county executive sets those voluntary guidelines based on data. If you look at the vast majority of landlords, we looked at the data over time, 90% plus are increasing within the voluntary guidelines, which is a normal increase, and that is still allowed. What this is preventing are these astronomical increases that would be higher, in which our DHCA, Department of Housing, considers, for example, a 10% increase constructive eviction. And we don't want that to happen, because that's going to put people at vulnerable. Even if that only happens to several thousand people, that's a huge impact in a county of 1.1 million. So they'll still be able to I have spoken to those smaller folks. They can still increase under the guidelines. This would just extend the period and hold it at that level.
Appreciate that again. And the current guidelines are such that how much of an increase can they?
1.4, I think it's 1.4% right now.
Okay.
A year. Yeah.
Got it. Okay. That's very helpful. Thank you. I did have a question for the county executive. What's the latest on the discussion heading into the vote on the 21st by the TPB, hot lanes and I-270?
I had a nice meeting with Greg Slater the other day. We talked for a couple of hours. He's obviously not in a position to make any decisions, but we talked about, some alternatives, some ways of addressing. I mean, there's no debate between me and the governor and most of us and the governor about whether there needs to be traffic relief. The really question is, what do you need to do to achieve it? And are we in some ways overbuilding a solution which just makes the project more beneficial and profitable to a P3 partner? If this was a state project and we were paying for it, I doubt if we would build more than we needed to build, because we wouldn't be interested in the profits. We'd be interested in solving the problem as efficiently as we can. This P3 doesn't do that. And we do need, there are other needs we need beyond I-270, frankly. When those people come off of I-270, if all they do is speed into major traffic jams on Wisconsin Avenue, Connecticut Avenue, and Georgia Avenue, they're not going anywhere fast. All you're doing is speeding them to the back of the line. So we talked about, solutions that include more than just what you do on 270. I've advocated from the beginning, and the governor seems to have missed this. It was me that suggested they started the American Legion Bridge. So to go out there and tell people that I don't want to do the bridge is completely wrong. I think the bridge has to be dealt with. And I said that in the beginning. And I think this thing has to go to Frederick. I mean, the idea, we're getting pressure from our residents, and they're saying, you've got to approve this project. I'm up in Clarksburg, and it's a total mess. And people in Frederick are saying, you need to approve this. They don't realize that the governor's project stops at the ICC. He is not committed to building anything north of the ICC, which would leave the northern part of Montgomery County and residents going up to Frederick out in the loop, out of the loop. And I raised this with Secretary Slater and said, this has got to be a complete solution. When O'Malley came to us, a decade ago, his solution was Frederick to the ICC. Governor Hogan has reversed it and done the bridge to ICC. We told O'Malley he needed to go south and go toward the bridge, and we're telling Hogan you need to go north and go to Frederick. We need a complete solution, but we need the most efficient solution, and we tried to convey that to the secretary, that we're not opposed to dealing with the traffic. We want to deal with the traffic, but we want something that's actually going to work the way it's advertised.
So do you see something different coming out of the July 21st meeting as a result of any information you're getting from the secretary? Any indication of a change?
The secretary didn't tell me what his vote count was. And I wouldn't talk with him about what our assumptions are about the votes. I mean, we're hoping that we can hold people with us and bring the state to the point that we can actually have a conversation about addressing some of these issues. And if we feel if we can get everybody to stay where they were, we can actually get to the point of saying, okay, now that we're done with the drama and all the finger pointing, how about we sit down and figure out how do we deal with the traffic relief problem from the bridge to Frederick? That's what we would like to see happen.
Understood. Thank you very much. Can I do one more question?
Sure, you may.
Thank you very much for Dr. Gayles on schools and concern about either outbreaks in schools and I know we haven't heard anything from the FDA lately on the likelihood of getting children, say, 7 to 12 vaccinated. What's the latest on that? What's your outlook?
Thank you, Kate, for your question. So you are correct. There have not been any updates from the FDA or CDC regarding the availability of the vaccine for children under the ages of 12. Obviously, we are all hopeful that that will come sooner than later, particularly as children re-enter school in the fall at full capacity. Now, with that in mind, the CDC did release guidelines on last week for schools to take a look at and recommendations regarding continued use of face coverings, particularly in children who are not eligible to get the vaccine, as well as a list of other measures, again, to, in the absence of them having the vaccine, to help mitigate transmission as much as possible within those settings. Several weeks ago, I put forward a list of recommendations for particularly related to face coverings as the governor's provisions expired at the beginning of July. And again, it was consistent with the recommendations CDC put forward last week, as well as the ongoing recommendations from the American Academy of Pediatrics, strongly recommending that those who are not vaccinated continue to wear face coverings, particularly those children under the age of 12 who've not been able to receive the vaccine. We've been working with to provide guidance to non-public schools as well as the public schools, and I know they're continuing to work through their plans and will be announcing their plans as we get closer to the schools reopening in the fall.
Thank you very much. I appreciate it.
Okay, our next question is from Kevin Lewis from WJLA. Kevin?
Hi, good afternoon. County Executive and Councilmember Jawando, if you wanted to weigh in on this as well. There's been some talk on social media drawing contrast between the bill to postpone late fees for renters for at least a year and the plan to reinstate late fees for county parking tickets as of August 1st. How would you respond to what people are saying is a double standard, or the private and government sector looking at this being treated differently?
Not paying your rent gets you evicted, and not being able to afford your rent gets you evicted. A late fee on the on a parking ticket doesn't get you evicted. These are huge problems for people because they're coming on top of huge mortgages that people have a hard time paying. I'm happy to look at the question about late fees, but I don't think that a late fee on a parking ticket's the same thing as a late fee on a rental payment, where you might wind up losing your housing over that.
Yeah, I would just agree. It's apples and oranges. Obviously, one of the main themes of this pandemic has been how unequal it has hit certain communities and impacted folks. To get a parking ticket, you have to have a car. And not that anyone who has a car hasn't dealt with things during the pandemic, they absolutely have, but I just think it's a false choice. It's a different issue, and we want to make sure people are stable in their homes.
I appreciate both of those answers. And just to follow up, I am uncertain if you are an owner of a property in the county and you are struggling to pay your mortgage and property taxes, are there any, is there anything in place to help folks who might not live in a $2 million house in Bethesda, but they're in a home with a mortgage that might be assessed at $300,000, $400,000. They're struggling right now to pay property taxes. Is there any policy that the county has in place to help folks in that situation?
I was looking who on my staff here is in.
Yeah, I can weigh in if you'd like. So just for the record, Alana Branda, Deputy Chief with Services to End and Prevent Homelessness. So in terms of the mortgage, we would recommend that they work with any of our housing counseling agencies located here in the county that can help negotiate a forbearance with their mortgage company or with their lender for them. That was part of the federal package that the companies are supposed to negotiate and work with households to do those forbearances. They're generally done on 3-month increments, but can be renewed. The state of Maryland did also receive additional funds through the American Rescue Plan to provide a mortgage assistance program. I believe they released the draft policy of that plan last month. They had it open for a comment period before it's open for actual applications. So there will be some financial relief coming from the mortgage payments for that. I unfortunately can't speak to the property tax side, but at least from the mortgage side, those are some resources for them to use.
All right, that's really informative. I might follow up to see if there's anything with property taxes by email, but thank the three of you for your responses there.
All right, thank you, Kevin. Next question is from Stephanie from the Washington Post. I believe, Stephanie, is this your first question at our press briefings?
Yes, it is.
All right.
Good afternoon. Thank you, everyone. I was wondering if you guys can speak to the county's COVID equity initiatives. Specifically, how much funding has the county put in for these initiatives, and will they inform future projects?
I'll let somebody else talk to the dollars, but the bigger question is, will they inform future projects? I think one of our takeaways from COVID was how we were able to reach out into the communities and the way we were able to pivot from kind of a traditional government services approach to really bringing in community partners to a degree that we had not done before. And that is going to be an ongoing feature. We realized that the community partners brought a lot of value to this, and that value could well continue post-COVID in terms of helping people, residents, know more about what we offer and helping us know more about what people need. So the ideas that came about out of that and the experiences that came out of the equity work, I think, are going to continue to inform our practices in general now.
I would say too, I don't have the exact monetary value. I think we can get that information to you. I don't know if Dr. Stoddard was going to speak to that, but the county executive referenced, we have been working with community partners on a long list of issues to address health equity throughout the county pre-COVID, and that work has continued in the COVID space and certainly will continue to move forward. We've been very strategic and proactive about using data to tell different stories and to highlight where there are pockets of disparities, because part of the challenge in Montgomery County is when we look at our overall numbers, the overall numbers across a lot of different indicators score well in comparison to other places. But when we break the county down by zip codes and break it down by neighborhoods, we do see more significant differences in life expectancy, differences in health outcomes, differences in terms of where people access and utilize for healthcare for their particular needs and issues. And so we've been working on that for a number of years and are hopeful that the collaborations and networks that were solidified during COVID, were reintroduced in COVID, and were discovered in COVID will continue to be able to chip away and improve those differences in outcomes.
I too don't have the dollar number off the top of my head. We certainly can get that for you. It's several $1 million. And we want to obviously thank the county council for obviously supporting those efforts as well. I would note too that, you know, you're talking a little bit to lessons learned that we've learned from the pandemic, and there are certainly going to be a number of those, even within the health equity space. And to give you an example of that, obviously we learned a lot about what kind of outreach and communication infrastructure needs to be in place, not just to you know, have healthcare infrastructure, be able to communicate that effectively to the residents throughout the county, in different parts of the county. And I would even say that as we've seen different health initiatives work, they've learned from one another. And I think that will inform some of the processes moving forward. There's been differences in the way that the Latino Health Initiative has approached things, and the African American Health Partnership have approached things. And there's been differences in the rates at which that they've been able to implement certain programs based on their strengths and weaknesses that I think will inform moving forward how we do some of these health equity efforts, as Dr. Gayles alluded to, based on the experience of COVID-19. Many of the issues that existed in COVID-19 were simply exacerbations of pre-existing conditions that have been known historically, and we need to deal with more effectively. But obviously, we've learned a lot about how to do that in an environment like COVID that is applicable to how we may be able to improve those efforts moving forward into the future.
Thank you so much. I have one follow-up for Dr. Gayles. I've seen on the dashboard that the average per capita dose rates for Latino, Black, and Asian residents are higher than white residents. I was wondering if you can contextualize what that means.
I'd have to have more context in terms of what you're specifically referencing in terms of doses. I'm guessing you're referencing the number of vaccines that have been administered. In that case, from the very beginning, we used when looking at kind of performance as a baseline, white residents in the county, their rate of vaccination compared to other groups. And in the early stages of vaccine distribution, we saw significant gaps in terms of the percentage of residents based upon their makeup of the overall population, as well as the percentage of those vaccinated. And I believe the gaps were I think the Latino community started somewhere around 20% lower, as well as the Black community. And we've seen significant increases. I know the Latino community actually improved significantly to where their rate was actually higher than white residents within the county as a baseline. And my last recollection was that the Black community lagged behind. It had improved significantly from that initial 20% or so, and had dropped to single digits in terms of having slightly lower rates. So if that's what you're contextually referencing, that is what that means. And it underscores the efforts that were discussed earlier from an equity perspective to ensure that we did our due diligence, particularly in those communities that you referenced in terms of vaccine rates. Those communities also had much higher rates of new cases, rates of hospitalizations, and unfortunately also rates of COVID-related fatalities.
I believe the Pulse report for this week said that for the Latino community, we are approximately 5% above the rate for whites, but I believe for the Black and African Americans, we're still about, I think, 7 or 8% below. But as Dr. Gayles alluded to, it's a market improvement from where we started. We have more work to do, clearly, but obviously we've made significant progress in getting into our Black and brown communities and getting them vaccinated. In large part thanks to Dr. Gayles, the nonprofits, and the team that's been working on that.
Thank you, Dr. Stoddard. We also have a question here from Colleen from the Patch. And Colleen, am I correct that this is your first question at our briefing as well?
Yes, that's right.
All right, couple of new timers.
Thanks for having me. Good afternoon, everyone. This is a question for the county executive. The Bethesda African Cemetery Coalition has been pretty vocal and active over the last week opposing any sale of the Westwood Tower. And they named you in a recent statement and said, quote, "The fact that he has been working with the developers against the community that got him elected is a travesty of justice." What would you say in response to that?
Pretty much nonsense. I haven't been working with the developers. I didn't know anything about the transfer of this property until I was told that Park and Planning was going to do that. The only developer I ever talked to regarding the cemetery, which actually isn't the cemetery where that building is being built, is not on the cemetery. The cemetery is on the driveway that is owned by HOC, or was owned by HOC, and on the park and planning property. It was never on the property that they're on, where the building was, but where the construction's going on. But my contact with the developer was to try to arrange a meeting between the developer and the Bethesda African Cemetery Group to get the owner to allow one of the representatives from the group, or the archaeologists they wanted, to be allowed to come on the site and observe the excavation of the site from the site. That was my extent of my involvement with the developer, was to try to help Marcia and her group actually get access to the site during the excavation. So I'm not quite sure what she's talking about, but you just don't get to make up the facts. I've been involved. I've worked with that group for a very long time. I continue to try to get an agreement on memorialization. We've always talked historically for years that memorialization and the cemetery were on those two pieces of property beside the HOC building. That is all we ever talked about in terms of what we were supposed to accomplish, and the sudden shifting and claiming and telling people that people were digging on the Moses cemetery is just factually untrue. And if you would like to see the maps that show where the cemetery was, if you'd like to see the historical documents that show where the cemetery was, if you'd like to read a letter from the other Moses group that has a cemetery up on Falls Road but had kinship relationships with people here, I'm happy to provide you all that. Because this discussion of a cemetery where there's actually no historical evidence that there was a cemetery is not true. I agree with the group that they were not treated fairly by Park and Planning. The Park and Planning continues to minimally involve them. I don't understand how they go forward with a plan for memorialization without engaging the community. But I can't stop HOC from selling the property. That was one of the requests that I blocked the sale. A county executive has no ability to block the sale of property. I had no ability to stop construction on the site of the storage units. I did get the state's attorney involved. John McCarthy went out. He made sure they were in compliance, checked to see whether they had the required archaeologists on site, that they were doing the excavation in the way that Park and Planning had stipulated it. Absent any evidence that they weren't doing things according to the law, I don't have the ability to arbitrarily stop construction. This county is still a democracy, and county executives are not afforded dictatorial powers. So I'm limited legally by what I could do. And absent anything that indicated a violation of the terms of the Park and Planning agreement and any violations of the law, I could not stop this. And I went as far as talking to the Maryland historical folks about this, and if there was anything that they saw that I could act on, and the answer from them was also no. So I don't work with developers. I'm not working with developers on this. Like I said, my contact was only intended to help Marcia and the archaeologist that she wanted to get access to the site. That's it.
Thank you for that context. One follow-up just to clarify. I've seen over the past couple of years that there have been some talks to designate it as a historical zone. Is that what you're talking about when you say that you were talking to the Maryland Historical Society, was it? And if so, do you know why that hasn't been able to proceed?
Well, no, I don't think anybody's filed for a historical zone. But what the counties agreed to do was that it needs to be memorialized. The full context of this is it's around the 1950s. A developer went in there and basically totally desecrated the cemetery. They didn't do anything they got no permission to exhume the bodies. They got no permission to relocate the bodies. It appears that what the owner did was basically either load the soil and bodies into not bodies at that point, skeletons, into dump trucks and dump it someplace, or bury it on site in part of the areas they built up with fill. Nobody knows for sure whether they were removed or buried, but the fact is they absolutely, totally desecrated the cemetery, and nobody did a thing about it. That's just historical fact. But it's also historical fact that Moses Cemetery purchased property on the two lots that are now, the lots that are now two lots beside HOC around 1911 or 1912, and that's where they built the cemetery. The other property was owned by other people. It was owned by an individual. At one point, part of the land was owned by the school system. At no point was that property ever part of Moses Cemetery. That's just factually the truth. And like I said, if you want documents, we'll give you all the documents in the world.
Thank you. I appreciate it.
Okay. We do have another question regarding rental relief that I wanted to share, and that is it's kind of a two-part question. What is being done to ensure the timely processing of rental relief applications? And the rest of the question is, and what relief is available to renters who haven't lost income during COVID, but were already in economic hardship before the pandemic began and were unable to improve their income situation before the economic impact of the pandemic?
I can talk some, and I think Alana probably would talk some, but basically the money we've got for COVID relief is limited to COVID related job loss. So the large tranche of money we have is for tenants who lost their jobs because of COVID. Those are the rules that are attached to that. We have some other money that we've had that's been available historically previous to COVID that continues to be available. I'm not sure if it's been used up yet for people who had losses not related to COVID, because there wasn't COVID before COVID. So the regular course of people actually losing access to their housing or being in danger of losing their housing. So we do have some funds, but it's not at the magnitude. The COVID payments anticipate potentially months of back rent. Our normal program would not go as far as the COVID payments go. As far as timeliness, we have a large group of people working on this. We are, as I said, I think we're current on people who right now we know are facing eviction in terms of having them in the queue so we can support them. We are trying to keep up with that. We're working with the courts so that we can get a regular weekly update on anybody who's been added to that list, so we can check them against people who have already applied. And if they're not on the list of applied, we can reach out to them and try to get them to apply for support. The application process is not easy. Staff has spent a lot of time having to follow up on either information that's incomplete, which is one big issue. Also, landlords have had up to 10 days to respond, which can hold up processing of this. And if Alana wants to elaborate on that, I would welcome any elaboration.
Yes, I can just add
Alana, if I could just chime in real quick. I just have to leave in a second, but I just want to say the other thing that's available is passing this bill so that rents don't go up.
Right.
and we should, do that, because that'll help everybody, and regardless of your situation. But again, thanks for having me. And if anyone else has questions, just please follow up my office. And see you, Alana.
Thank you. So just put some numbers to some of it. We have brought on or reallocated approximately 40 staff to just focus solely on the COVID rent relief program and getting that money out. And as the county executive mentioned, we are consciously spending time with each application, not only just to make sure we have all the documentation and that we pass any treasury inspection, but also to maximize the benefit that each individual will get. There are some people who, how you define income, how you look at the ledgers and the rent allocation, we really want to make sure that no one is leaving with any less than we could support them with. So I just wanted to add that. I apologize, Barry, I forgot the other part of the question, but there was something else I had when you first mentioned the question that I remember. So do you mind repeating the second part? I think it was of the question.
Sure. The second part really was.
Sorry, I remember now. The relief if it's not COVID related. Yeah. So I would just, I just want to, emphasize also, if someone receives an eviction notice, whether at the point of having a court hearing, the judgment, or if they receive that red and white, whether it is COVID related or not, they should please call 311 and ask for eviction prevention assistance. As the county executive mentioned, we do have assistance available for non-COVID related to try to prevent evictions at that point. We also provide moving and storage assistance if that is ultimately what the individual is going to do, and security deposit and first month's rent assistance to help someone, if they are moving, get set up where their new location is. With the treasury funds that we have now, with the emergency rental assistance funds, the definition is that you have had a financial impact from directly or indirectly due to COVID. So we do encourage people, if they think in the scenario that Barry was mentioning in the question, where the person has been unable to find a job because of COVID implications, that may qualify. So, if you think you may be eligible, we encourage everyone to apply. And when our caseworker gets that, they will have that conversation and review with them that firm eligibility.
Thank you all. I don't see any more questions in the chat, so we will go once for another question, twice for another question, 3 times. Thank you all for being here today. I want to thank our guests, certainly thank Councilmember Jawando for joining us today. Thanks to our first timers for your questions. And we will be back next week with another press briefing with the county executive. Thank you very much and enjoy the rest of the week.